Hey guys, my name is Nick. In this week's module, we learned about different types of eating disorder. My presentation is on night eating syndrome. As we learned in this week's module, eating disorders cannot be attributed to a single factor. There are a set of circumstances that can trigger an individual to develop an eating disorder, such as media, depression, anxiety, and low self-esteem. In essence, eating disorders are mental health illness with complex pathologies affecting both mental and physical. What is night eating syndrome? Night eating syndrome is defined as a disorder that is characterized by a patient eating at night. The patient is fully aware and they will not be able to sleep unless they eat. This behavior becomes a setter pattern for the patient. I came across a study that stated that NES patients have a dysregulation in their circadian rhythms, such as the pineal gland, which secretes melatonin, which helps regulate our sleep cycle. Causes of NES. As stated, the onset of NES is not cleared. However, studies have shown one of the causes of NES is a disruption in the hormones that regulate sleep and appetite. Another thing that may cause NES is mood disorders and the amount of stress that a patient is experiencing. NES patients have different signs and symptoms, unlike the other eating disorders that we learned about. First, patients are awakened at night to eat an excessive amount of food. They experience no self-control over the eating episodes, and because of this, night eating causes them distress and impairment in daily functioning. Because of this type of behavior, NES patients are predisposed to obesity, depression, anxiety, and type 2 diabetes. Treatments for NES should include psychotherapy, medication, behavioral therapy, and nutritional counseling. Conclusion. In this presentation, we learned that night eating syndrome is a disorder that is characterized by a patient eating an excessive amount of food at night. One of the attributing causes of NES is the disruption in the hormone that regulates sleep and appetite. Patients diagnosed with this disorder have a series of other psychological and physiological problems. Treatment should include psychotherapy, pharmacotherapy, and nutritional counseling. Regular activities such as exercise should be introduced to the patient while they're recovering from NES. However, the introduction to exercise should be monitored by an exercise physiologist, since this will help the patient develop a healthy view on exercise and will not abuse it. Thank you.